Hi everyone, this is David Larson. I'm the Associate Chair for Performance Improvement in the Department of Radiology at Stanford University, and this is the Realizing Improvement Through Team Empowerment program. Today's topic is collaborative problem solving. Today we're going to tell the tale of two academic medical centers, Bikram State University Medical Center and Salvan University Hospital and Medical Center. Both are elite medical centers located in a cosmopolitan area, but there's one difference. Bikram State Medical Center is located next to the prestigious Bikram Law School, which contains the brightest aspiring and practicing lawyers in the country. Salvan's Medical Center, on the other hand, is located next to its top-ranked engineering school, which contains the brightest aspiring and practicing engineers in the country. So what difference would this make? While engineering and law are both honorable and important professions, they have different approaches to problem solving. The law school teaches an adversarial method of problem solving, and the engineering school teaches a collaborative method. Now let's first talk about what these two methods are and why they're each appropriate for their own respective environments. In the adversarial method, there are two parties who disagree over a certain point where they each have a strong interest. For this issue, these opponents or adversaries need a way to determine how to resolve the conflict fairly according to the established rules. Each side retains an advocate, which is someone who understands the rules who can speak on their behalf. If it gets to the point where it's needed, an intermediary may step in to help solve the problem. A healthy legal system effectively solves problems day in and day out and is vital to the well-being of a nation and an economy. Engineers, on the other hand, deal with different kinds of problems and deal with those problems differently. Let's say you want to send a rocket to the moon. You're going to need a team of engineers. Such a team would be made up of many people with different types of expertise, perspectives, preferences, and opinions. If you've ever managed a team of engineers, you know that they don't agree on everything all the time. In fact, to an outsider, it sounds like they are constantly arguing. But good engineering teams have a productive way of debating and discussing that leads to the best possible solutions, and these solutions are responsible for a great deal of what we call our modern way of life. Okay, back to our story. Well, it turns out that since Bikram State was located right next to the law school, that the medical school faculty would spend a lot of time with the law school faculty. And after a while, the doctors adopted a lot of the same approaches that their successful colleagues at the law school used, including an adversarial method of solving problems. Meanwhile, the doctors at Salvan U spent a lot of time with the engineers, and after a while, the doctors picked up many of the engineers' approaches, including the collaborative problem-solving method. So here you have two academic medical centers that are alike in almost every conceivable way, with brilliant clinicians, staff, students, and trainees, administrative and support staff, and with a lucrative payer mix, and affiliated with prestigious universities. The only way they differ is in how they solve problems. Well, both institutions enjoyed tremendous success for many decades. They were both in a fee-for-service environment and were well paid for everything that they did. This meant that the different departments didn't have to cooperate very much. They each mostly just did their own thing and were reimbursed for all their efforts. The patients were happy, the doctors were happy, and, of course, the administrators were happy. Because of their great success, they grew. They added clinical programs, new buildings, and many more staff. They added new satellite clinics and outpatient facilities. They added advanced life-saving technology to better care for their patients, especially their sicker patients. And as they did this, they continued to thrive financially. It was a great time. But they started to have some growing pains. As they grew, in order to function smoothly, their many people and services needed to cooperate. This didn't always happen, so miscommunications started increasing. This led to problems like increasing wait times. It also led to an increase in medical errors, sometimes serious ones. This was upsetting to the physicians and other clinical staff. Things just didn't seem to work very well. They were working harder, yet seemed to be spinning their wheels a lot. Many of them started to become burned out. And after a while, the patients also started noticing it. They still appreciated their skilled caregivers, but they acutely felt the lack of coordination. For a time, despite these problems, they were still quite profitable. However, the payers weren't happy about the increasing costs. The payers passed those costs on to the patients and to the taxpayers, who also weren't happy. To respond to this, the payers decided that they would no longer pay on a fee-for-service basis, but would bundle their payments in a variety of ways. This meant that growth in reimbursement would slow. This also meant that each medical center would have less income or revenue. Meanwhile, the hospital administrator saw that costs were continuing to increase. This meant then overall that profits were likely to fall significantly. It became clear to everyone that something needed to be done. The staff from all the different departments at each medical center started to get together to figure out how to better coordinate their efforts and to solve problems one at a time. Each of them used their own problem-solving methods. At Bikram State, they saw the problem as one of many different constituencies with inherent conflicts of interest who couldn't easily agree. This looked exactly like the type of problem that their friends in the law school dealt with on a daily basis. So they adopted the same approach to problem solving. Just as a lawyer advocates for their representatives, the leaders of each department, division, and unit were also expected to advocate on behalf of their area. Specifically, they adopted many of the time-honored strategies used in the legal field. For example, when a problem came up, first they would decide on a position to take, each specific individual would. Then the advocate would stake out a position, leaving room to negotiate a compromise, anticipating that the other sides would also negotiate strenuously. They would then make compelling arguments and anticipate and refute their opponent's arguments. When the data were available, they would find and share the data that would benefit them and refute any data that the opponent would provide. Each player would enlist allies and at the same time anticipate their opponent's possible coalitions and allies. They would undermine their opponent's credibility. Now, they wouldn't destroy them, after all, they were their colleagues, but each would make it clear why their opponent was less qualified to discuss this particular issue than they were. They were wary of any compromises that could possibly lead to a slippery slope down a path that would undermine their position. They would draw on whatever sources of power they could muster, such as finances, enlisting people to their cause, and using direct authority when needed. When they were implicated as being the source of the problem, they would use a variety of strategies to counter the attack, such as reacting with indignation, pointing out the flaws in others, and calling for additional meetings or investigation. So meanwhile, the folks at Solvin U were faced with the exact same problems. However, when they saw a so-called problem, they didn't view it as a conflict that needed resolving like their counterparts at Bikram. Rather, they saw problems as challenges that required teamwork and ingenuity to overcome, much like the types of problems that their friends at the engineering school dealt with on a daily basis. So they used the collaborative problem-solving method, where they would determine the overall objectives, evaluate what resources and constraints they could use to solve the problem, break down the goal or objectives into manageable sub-goals, come up with several alternative courses of action, and predict the likely outcome of each. They would realize, of course, that all predictions are inherently wrong and that they need to be validated, so they would iteratively test and refine their solutions before implementing. They would seek out and freely share all relevant data, and they would search the literature and learn from others who had dealt with similar problems. They would recognize that some possible solutions might impact different areas positively or negatively, and they would be open and honest about this. So they would seek to mitigate the negative impacts on others as well as on themselves. And finally, earnestly seeking a meaningful solution, they would manage the project to ensure that it continued to progress towards a solution. So let's look at a couple of examples. One problem that arose early on at Bikram State was that the hospital planned to install a new cafeteria. The question arose, where should it be placed? The ICU manager maintained that it must be located on the ground floor near the atrium. He argued that it was most convenient for the patients, cheapest to build, and it's where the nurses wanted. What he thought in his mind but did not say was that it was most convenient for him. What the lab manager thought but did not say was that the atrium was also most convenient for him. So he expressed support for the ICU manager's proposal, though he was sure to do so grudgingly to make it look like he had acceded to the ICU manager's wishes. In this way, he hoped to store up political capital for the next negotiation. At the end of the day, it was a victory for the adversarial method of problem solving, or at least it seemed to be. But it wasn't long before another problem arose. This time it was found that CBC orders for the ICU were taking too long. The ICU manager demanded their own CBC analyzer in the ICU. The lab manager responded that it was too expensive and too difficult to manage a machine outside the central lab. The ICU manager responded that their patients were too sick to wait. He was starting to get irritated. The lab manager fired back that the ICU was not the only one with sick patients. The ICU manager reiterated that the service was unacceptable and that the best solution was to get their own machine. The lab manager countered that it was not their fault that the hospital would not give them the resources they continually asked for. Having made up his mind, the ICU manager stated that they were going to Capitol to get the budget for their own machine. The lab manager said they would not support that request, with a veiled threat that he would block it. The ICU manager indicated that if they didn't get the needed support from the hospital, they would just do it themselves. Sensing defeat, the lab manager protected himself from collateral damage by renouncing any willingness to help manage or maintain the analyzer. After it was all said and done, the ICU installed their own analyzer, which they staffed and maintained without support from the lab. It had many problems and remained a source of contention for years. At Solven, they also had the exact same problem with CBC orders. The ICU manager started out the conversation with the lab manager the same way, stating that they needed their own analyzer. The lab manager inquired as to the need for the analyzer so he could better understand. Recognizing his good faith effort to understand the situation, the ICU manager described the delays that were impacting patient care. The lab manager asked the ICU manager to walk out of the office and look at both the process in the ICU and the lab. He'd also pulled some data and did some research on the problem. The ICU manager reviewed the findings with the lab manager and noted that the biggest delays were happening at night. The lab manager had noticed the same thing and was already working on a new staffing model. At the same time, the lab manager pointed out that the ICU's batching of orders was probably contributing to the problem. The ICU manager did not react offensively, but described why they were batching and promised to run a test of a continuous flow model instead. He also brought up the issue that they were not always being notified about critical results. The ICU manager promised to look into it, shared the upcoming plans, describing their immediate countermeasure. After they had collaboratively worked through these and many other issues, the ICU and lab managers were able to significantly reduce the time for CBC orders without having to purchase a new machine. So let's review the iterative process of the collaborative problem-solving method. And this may seem a little abstract at first, but we'll give an example of this in just a minute. And before we start, we first need to list out the following categories: objectives, constraints, possible solutions, and likely outcome or impact of each of the possible solutions on each objective. Often the first thing that someone suggests is a solution. We know by now that we should try to avoid jumping to solutions, but it can be okay to use as a starting point. When someone starts with a solution, we can pose a question: what do you think will be the effect of that? The answer is generally that someone thinks it will make something better. That desire to make something better is your first objective. However, someone may point out that the proposed solution might make something else worse. That desire to preserve that functionality is your second objective. Someone may then come up with another idea. They will often provide an example of another positive impact it's likely to have. That then becomes another objective. Someone may offer yet another solution. It may become clear that it just isn't feasible for some reason. So congratulations, you've just found your first constraint. Hopefully you can recognize that what may seem like arguing at this point is actually a productive dialogue. At this point, you may want to just go ahead and list out all the possible solutions you can think of. As you talk through each solution, you will likely find more possible outcomes, revealing more objectives and constraints. As you add objectives, constraints, and alternative solutions, you should walk through each solution by one and think about the likely outcome of each solution on the objective, recognizing that really fixing the problem will almost certainly require a number of solutions rather than just one. And it's important to recognize that everything is just a hypothesis for now. All of these thoughts need to be validated. The prediction of how changing the inputs will affect the outputs is what engineers call a model. It may be mathematical or it may simply be descriptive, but it is a prediction and it can be tested, often after it's broken down into pieces. If you don't know exactly how your proposed solutions will affect your objectives at this point, it's okay. This is where you might call in an expert to help you further develop your model if you need to. Okay, so let's walk through our example of how the ICU manager and lab manager worked out the problem at Solven U. So before they started, they wrote out the 4 categories: objectives, constraints, possible solutions, and likely outcome for each solution. The ICU manager said they needed a new CBC analyzer. Why? To decrease delays for CBC orders. So there's our first objective: minimize delays for the ICU. But the lab manager pointed out that it was too expensive and hard to manage. So there are our next 2 objectives: minimize cost and keep the management as simple as possible. Because of these drawbacks, they decided to put buying a new analyzer on hold for now, and so the next proposed solution was to change the staffing model in some specified way. It's thought that this will decrease delays, but that's very uncertain, so they'll have to test some scenarios. They think the cost and management with this approach will be reasonable, but we don't think that changing the staffing model will completely solve the problem. The lab manager proposes, in addition to the changes in the staffing model, that the nurses stop batching their orders. It won't have much effect on the other outcomes, but he thinks it will improve their ability to predict incoming orders. So there is another objective. However, the ICU manager is afraid it might impose too great a burden on the nurses. So there is even another objective. The ICU manager asks about the possibility of moving the entire lab close to the ICU. They quickly walk through the likely impact of each objective, but they note that it would require major construction. Since a freeze has been put on all construction, they've now identified a constraint. They cross this idea off the list. Next, the manager asks about creating a new alert in the electronic medical record. After running through all the likely impacts on the currently stated objectives, they realize that it would require new logic in the EMR. Since there's also a hold on all EMR development, they've found another constraint, so they cross that one off. The ICU manager asks about prioritizing their orders, but the lab manager points out that it may delay other tests. That's yet another objective, and they keep working through this problem collaboratively in this manner until they gradually find, test, and refine workable solutions. So here are a few tips as you work collaboratively to solve problems. First, while we try not to jump to solutions, it's okay as long as we use that suggestion of a solution to ask ourselves what the solution is meant to accomplish and then backing up to find the objectives. Second, go ahead and list out the objectives. Write them down. Don't be offended. Don't think it's silly. Just go ahead and do it. It really will help. Third, don't be afraid to generate several alternative solutions. Keep an open mind. Consider most anything at first. Fourth, recognize that your estimate of the impact of a possible solution on an objective is a hypothesis. Like most hypotheses at first, it's likely wrong, or at least in part, so you've got to test it. Fifth, be open and honest about the potential impacts of solutions. If you think it might negatively impact your area or others' areas, go ahead and say that. If you don't know for sure what would happen, you should also say that. Sixth, show all of the data. If you ever find yourself telling someone about some data you saw, major alarm bells should be sounding. You should never tell about data. You should always show the data. Finally, when you find yourself at an impasse with your problem-solving partner and it's starting to feel like an adversarial problem-solving session, then stop. Back up to your shared objectives and start again. Once you've established those shared objectives, you can move forward collaboratively. So what happened to our two medical centers? Well, it turns out that Solven U became very proficient at solving problems, whereas Bikram State spent a lot of time talking and had little success in actually solving the problems. And the solutions they did come up with usually weren't very optimal. As a result, miscommunication went down at Solven U but continued to rise at Bikram State. This decreased the medical error rate at Solven U, which was great news for the medical staff. Wait times went down at Solven, but continued to rise at Bikram State, which improved patient satisfaction at Solven. So word got out, and more patients started to choose Solven over Bikram State. The insurance reimbursements that were predicted to level out did so at both institutions, which relieved the payers and the government officials. And revenues, which were predicted to slightly increase at both institutions, decreased at Bikram State, but increased at Solven U since so many patients started choosing Solven over Bikram. Costs, which were expected to rise at both institutions, did rise at Bikram State, but actually went down at Solven U, which meant that profit, which was expected to decrease at both places, plummeted at the Bikram State and continued to rise at Solven U. This made Solven's administrator very happy. So why did one medical center succeed while the other did not? It was the way that the many disparate groups and individuals got together and solved problems, or didn't solve problems as the case may be. At Bikram State, they treated the problems as conflicts that needed to be resolved, like a legal dispute, whereas at Solven University, they saw them as challenges that needed to be solved collaboratively with groups acting like disciplined engineering teams. So, to summarize, collaborative problem solving is critical to our future in healthcare. As you solve problems, you should identify objectives, constraints, alternative strategies, and likely outcomes for each strategy. Remember that this is an iterative process. New objectives, constraints, and strategies will come to light as you work through the process. Also recognize that most all predictions are wrong. Everything needs to be tested. Work toward developing a model that can be validated and refined. No one is allowed to advocate for a certain position or solution until this process has been worked through. Reserve judgment and keep an open mind. Don't take offense when someone offers another solution. Don't get angry when someone asks you to explain why you're proposing a certain solution, and don't get upset if you disagree about the likely outcome. This is just problem solving. Just work through it. And finally, life is so much better when you solve problems collaboratively in your organization. It's much more fun to go to work. It really is. If you're finding your work to be stressful and contentious, it may very well be that you're using an adversarial problem-solving model. Switch to a collaborative model. You'll be delighted with the difference. Thank you for watching. This is David Larson with the Realizing Improvement Through Team Empowerment program at Stanford.